concept for universal health coverage and state-by-state health schemes, with the Federal National Health Insurance Scheme as the highest regulator and policy maker in the country. Now, they normally do a nationwide scorecard analysis. So they go every year, they go around and they analyze how the states are doing. And based on that, they revise their policies. So, you know, generally speaking, the insurance scheme, as I said earlier, rides on the platform of primary health care. And primary health care is, at the moment, disorganized and not running according to the policies and the principles that have been prescribed by the National Primary Health Care Development Agency, which is the federal regulatory agency. So the issue that generally faces most of the states is this issue around catering for the poor. Now, there are two issues to it. There is compulsion and there is subsidy. For an insurance scheme to be functional, it needs to have a mandatory compulsion. We need to make it mandatory for all persons to be part of the scheme. The benefit for that is that it is a way of getting the more privileged people to subsidize the less privileged people. So that's one aspect to it. The other aspect is subsidy. If more than 60% of your population are not able to afford the premiums, how are you going to enroll them? It's mathematics, it's simple arithmetic. I can't pay, but you're making it mandatory. If 33% of Lagosians are the only people that can afford insurance, who is going to pay for the 66%? That's a major issue. What it means, essentially, is that state governments, three tiers of government, federal, state, and local government, have to carry 66% of Lagosians. When we did the mathematics, that figure is close to 100 billion naira in premiums alone. Now, where are we going to find that? It requires an out-of-the-box solution. I'm not surprised at the moment that the scheme is struggling to take off. It's struggling to take off for two reasons. One, there's lack of confidence in the platform. People are a bit wary to go to the public primary healthcare facilities because of a lot of them are in a state that's not absolutely desirable. There's a shortage of manpower within this facility. So if you take your family to a primary healthcare facility and there's no doctor there, what is your confidence about that facility? Out of the 330 primary healthcare facilities, only 57 have doctors. Most people will go to such a facility and say, there's no doctor around, I'm not coming back in. Because when I go to a hospital or when I go to a center, I expect, not that we are undermining the role of our nurses are fantastic, we have apex nurses that can do just as much as most doctors can do, but I think the general perception is when you go to the doctor, that's what they say, you go to the doctor. You go to see a doctor. You expect a doctor to be there. If majority of your primary healthcare facilities don't have doctors, then there's going to be a confidence issue. So that's one. So I can't force you, even though it's mandatory. I can't say you must go to the center. You say, well, give me a choice. Maybe I'll go to a private facility where I know there will be doctors. So a lot of private facilities are now being empaneled into the scheme. People would rather go to facilities where they know there is a standard that is, in their minds, equitable to what a clinic should look like. We're working very hard now to define a model for our primary healthcare facilities. So that leaves another 55% uncatered for. Federal is only through the BACPF, this basic healthcare provision fund, is only 1 billion. Lagos can put 6 billion. Federal is putting 1 billion. What is that? It's nothing. We actually need 50 to 60 billion naira to rescue the underprivileged and pay for their premiums so that they can enter the scheme, and then on the other side pay another huge amount of money for the supply side to refurbish all the facilities. Which is why a lot of people are talking about public-private partnership. Can the private sector come in to help rescue this situation and play their role? Of course, federal government doesn't really want to give the impression that, you know, we are dependent in any way on the private sector, because we're not. We're spending a huge amount of money, general hospitals, 330 private, human resources for health is a huge bill. Nurses, lives. But in most parts of the world, there's always some kind of relationship between public and private, because everyone recognizes that government can't carry everything. And therefore, there is a role for the private sector to play in the delivery of health to our people of Lagos. Lagos State government is shouting about roads, shouting about housing, shouting about security. Every ministry is a priority. I can't go to His Excellency and say, look, focus on health. He can't. He has to focus on transport. He has to focus on energy. He has to focus on security, on housing, on transportation, on the waterways, on climate change. Yes, someone talked about flooding. I don't know if I answered that. I said Lagos is a low-lying megacity. I'm not giving you a question. Just to show you that there are huge other issues the government has to spend money on. But health is just one of the pillars, very important pillars, but it all boils down to economics. Tariffs are very, very low. What you pay for in our government facilities is not what you pay for in the private sector. And that's one of the reasons why we're not able to run our hospitals sustainably, because what you pay for in a public facility is much lower than what you would pay for. And we want to keep it in an affordable state for our community, but it's not following the economic trends. One of the strategies that this administration has is, first and foremost, and even His Excellency doesn't know about this, but I'll say a bit about it here because it's still subject to his approval, is that we want to change the way in which we construct medical facilities, from primary to secondary to tertiary. At the moment, there is no blueprint and there is no standard. So we can get any contractor going anywhere without experience of building a medical facility, building a primary healthcare structure, building a general hospital. Someone who is used to building an office block is now taking on a contract to build a hospital. Building health facilities is a complete discipline on its own. People go to university just to learn how to build health facilities. So you can't just have any other contractor. As far as the government is concerned, we want to have at least one general hospital in one local government. And we have 57. At the moment, we have 28 general hospitals. So we've got a deficit there. If we are able to put one general hospital in each local government area, local council development area, 57, then we would have made a huge impact on bed space. But the primary healthcare is the foundation. And if we get the primary healthcare right, then it takes pressure off everything. Because the secondaries are under pressure, the secondaries are putting pressure on the tertiaries. So everything is skewed. We need to bring everything back. And that is to the ground, which is the primary healthcare platform. And if we can get enough beds in the primary healthcare, then we'll take pressure off the secondary, and if we can build more general hospitals, to build a general hospital is expensive. But this government is committed, and you can see that we're building, we've just commissioned 2 mother and child centers. We're going to finish 2 before the end of the year in Ekpe and Badagry with 9, and Governor Sanwo-Olu has promised that by the end of his tenure, he's going to increase contribution to health till we achieve that minimum of 15%. And true to his word, this year the budget has gone up from 8 to about 9 point something. And when you talk about insurance, 2%, asking the people that are in the formal sector to pay 2% is peanuts. In France, for example, you pay a mandatory 20% of your income for health, apart from tax. But when you're paying 20%, you know that you can walk into a facility and get the best treatment anywhere in the world. The issue around doctors and nurses, I'll talk briefly about it and then I'll ask our peers to comment on it. You know, when you have doctors or any profession, you know, there are established numbers of working hours and established number of contacts that any professional can have without exhausting the profession. So you can't, it's not confined to health. This is a standard, it's a workforce regulation. You can't force somebody to work like a pilot. You can't make him fly on unusual hours. Once you've done one flight, you see that the crew get off and a new crew comes in. Medicine and flying are very similar because they are to do, you see, their profession is so important. You make a mistake and people die.
So what we have done is to now get training. We have about 5,000 nurses in our workforce. So a batch of 1,000 nurses were trained around July this year on attitude. And they had never actually been trained on this. So they were trained, and they actually never realized that they were that bad. A lot of them confessed that, really? So this is how we are perceived. By the time the training continues, because it's not going to be just once, by the time we do it maybe quarterly, then you'll gradually see a change. But I do know that people are commenting already that things are a little better with the nurses. By the time we've done maybe in another 1 year, and it's translated not only to the nurses, to the doctors, to all the workers, I'm sure the effects will be clear.
So we need to make more doctors, and we need to plug the leaks. And it all revolves around what I just said. You can't keep healthcare professionals in this environment if you do not respect them. If you do not look after their welfare, they're not going to stay because other people want them. England wants all our doctors. If they can take everyone that we make, they will take them tomorrow. Because they're well trained. So we don't want them. They'll take them. And when we say we don't want them, I'm not saying we don't want them, or we're saying no. I'm saying you can demonstrate want in many ways. Want is create an environment that's conducive for them to practice. That's an aspect of want.